Hello, my name is Joseph Ngugi. I am a student physical therapist here at Andrews University, which is in Southwest Lower Michigan, for those of you that have no idea where it is. And today, my friend and colleague, Gabriela Pasos, is here with me. She's agreed to share about an experience that she had as an intern in Florida at the Florida hospital in a cardiac floor, correct?
Yes, I had my first internship at Florida Hospital in Orlando, and it was in the cardiovascular unit. I worked primarily in the cardiovascular ICU, so the intensive care unit.
That's fantastic. And so today she's come in. I'm going to ask her a few questions just to give you a taste of what that experience is like. So our first question, all right, so when you were preparing to go to your internship, what were your preconceptions?
Well, when I found out that I was going to be in a cardiac rotation, I was certainly very nervous. We had a very intense cardiopulmonary class. Our teacher was a cardiac physician assistant, so he was very knowledgeable, and we spent a lot of time going over EKGs, understanding all the different cardiac medications, and we went over lymphedema, we went over pulmonary, and it was a tough class. So I was certainly nervous because I knew that our school is at a high standard of what we were required to know for cardio here, and of course I felt like that standard would be carried through to the internship as well as it should be. And so I was honestly nervous about reading those EKGs and having a bunch of them laid in front of me for each patient. It turned out that the clinical was actually a little bit different than that, so I was happy, and I had a phenomenal time over the internship.
That's very good.
Yeah.
What was the most surprising or interesting thing that you picked up or learned from your rotation?
Well, actually, about 3.5 years ago, my dad had a cardiac arrest, and he had a very close call. His heart stopped beating for about 8 minutes before the paramedics arrived, and he was in a coma for about 4 days, and he actually ended up being transferred to the same exact unit that I worked on, which was the Florida Hospital Cardiac ICU. Florida Hospital has one of the largest and most advanced cardiovascular institutes in the United States. So he received wonderful care, and by God's grace, he made it. He had no brain damage, which was a miracle, because actually the statistics are 9 out of 10 people that suffer a cardiac arrest do pass away. So it was very emotional when I found out that I was going to be working on the exact same floor that my father had been on. I was very surprised, and I felt like I had a very personal connection to my internship because of that. I'd say the most surprising thing was, I actually did not even find this out until after my internship, but later on, one of my friends that I had met throughout this internship, he is a physical therapy tech, and he saw a picture of my family, and he reached out to me and he said, "I know your dad, and I recognize your mom. I actually treated him when he was in the hospital," and that just floored me. And it turns out I had 2 CIs throughout that internship, and it turns out that my first CI, actually, now that I think about it, I think both CIs worked with my father as well and helped to rehabilitate him back. So that was an amazing thing that I experienced throughout that internship.
Wow, talk about it becoming a little more personal than she expected.
Yes,
wow.
Certainly.
And so while you were there, when we were chatting about this prior to this interview, you had told me a little bit about your surgeries that you had seen, right?
Yes.
Would you mind telling everyone a little bit about that?
Yes, definitely. So I was very blessed with the opportunity to observe open heart surgery. Not everyone gets to do this, obviously. It was phenomenal. I was under the tutelage of the surgeon, cardiothoracic surgeon, Dr. Akala. He does these surgeries all the time, and I got to see 3 surgeries throughout the course of a day. I got to see double bypass surgeries. I got to see valve replacements, saw both aortic and mitral valve replacements. It was pretty phenomenal. I got to watch each surgery from beginning to end. I saw the physician assistant harvest the veins that they were going to use for the bypasses. I got to see them, take that scalpel and just run it down that person's chest, and then from then on take the bone saw and split the ribs open and use the retractors, and And I was most excited for that first surgery to actually see the heart, and and when they actually went through and opened up the ribs and cut through all the pericardial tissue and all the fascia, and when I actually saw the heart beating, it was an incredible moment for me, for sure. It was awesome just seeing all of the healthcare professionals work together in that room. The nurses, the surgeon, the physician assistant, the anesthesiologist, the perfusionist. The perfusionist is the one that actually runs the machine that circulates the blood throughout the body while the heart is not pumping. So that was incredible watching that as well. So I was blessed. Each surgery, each patient obviously has a different story behind them, but it was awesome just getting to see that.
Yeah. And I mean, for those that might be watching that are like physical therapy students or individuals that would love to witness a surgery, I would advise you to ask, because whether it's the heart, whether it's a knee, whether it's a shoulder, a hip, it's an excellent learning experience. And so, just as we heard from Gabriella, that's a big thing for you to kind of further your education. All right. Now, with the surgery experience, how would you say it furthered your learning, your academic growth?
Well, I would say that it certainly did further it. I did not see the surgeries until near the end of my internship, but it certainly gave me a new perspective as to what the patients go through. We learn in physical therapy school, we learn all these just precautions and protocols about how to treat patients after they have surgery, and typically we only see them afterwards, but actually being able to witness the actual surgery, and it kind of gave me a lot more sympathy, really empathy, I should say, for those patients. Watching them split, their chest open, retract their ribs, and understand why they're in so much pain. I mean, we understand that they had open heart surgery, but really being able to see that, it also definitely gave me some guidance as to all of those precautions, not lifting the arms past 90, no lifting, no pushing, pulling, etc. Really seeing those surgeries, it really helped me to drive in those to my patients and to understand the emphasis behind them. And because I did actually have patients throughout the course of my internship that went through dehiscence, which is when the incision and the sternum does not heal correctly and it begins to split open. Then the surgeon has to go in again for a second surgery, and the more times that the sternum, the more times that bone kind of begins to separate, and the more time it's fused back together, the more brittle it becomes, and it can lead to increased chance of infection. It can decrease function, of the upper extremities, etc. And so I think definitely it gave me a lot of empathy for the patient to help me to understand what they're really going through, and how we as physical therapists can help them.
Wow. It's a phenomenal experience. Now, for the student that's potentially listening right now that has said, man, I don't really know what to expect from a cardiovascular unit, and would love to kind of venture into it, or would like to know really, what to do next or how to find out more, what are some pieces of advice that you would give that student?
Okay, so I would say if there are any students that are interested in going into a cardiac acute care rotation, or will be going into one, I'd say definitely go into it with an open mind. I learned so much during that rotation. A lot of the basics are the same. We are there to transfer the patient, to get them up and moving. But obviously with cardiology being so specialized, I learned a lot about specific diagnoses. I had patients that were there either pre or post heart transplant. We also had lung transplant patients, cystic fibrosis, congestive heart failure, cardiac arrest, heart attack, tons of different diagnoses that I worked with. Obviously in our cardiopulmonary class, as I mentioned earlier, we did have to learn a lot about the EKGs. Thankfully, the internship was quite different in the sense where I was not directly responsible in interpreting all these EKGs the way that we were here in class. However, we did still have to know the patterns and be able to recognize normal sinus rhythm versus atrial fibrillation, ventricular fibrillation, etc. And one of the biggest things that I would say is do be aware of those patterns and be able to recognize them on the monitor. One of the biggest things that my CIs would always tell me would be, obviously you're looking at the patient, making sure that they're breathing and responding correctly, but you do have to look at the monitor, check their oxygen sats, etc. And I was always told that if they start to go into ventricular fibrillation, we have to push code blue, which of course brings in the rapid response team. So those things I'd say also one of the biggest things that I tried to do at the end of every day was reflect on what I learned, and if there's anything that I had struggled with, anything I didn't really understand, I would research it and I would figure out, okay, well, what is this diagnosis, or how do I best treat this patient? And so yeah, just to recap, I'd say go into it with an open mind, do your research though, and really try to take advantage of everything that you're learning and bring it in. Cardiac acute care, of course, it is based in acute care. It is acute care. It's just it's a little bit more specialized. But certainly I'd say take those things for sure.
Yeah, and I mean exactly what Gabriella just said in terms of researching during the evenings when you're not in the hospital or in the clinic, if that's where you are as a student. It's very important. That's something that most of us end up learning, because what you learn in class is very helpful, but sometimes you want to learn about something more specific and really brush up on it, and really know what you're getting yourself into by the next day when you go back. Now, Gabriella, if for the person that's listening right now that says, "Hey, I would love to know more about heart health and how to improve that. I don't know where to begin," what would you tell them?
All right, well, I would say the easiest thing is just to start moving, even if it means as simple as getting up from your desk in the middle of a long work day and just taking a few laps around the office or stepping outside. Really, our cardiovascular health is phenomenally, it's very, very important, extremely important. The American Heart Association recommends about 150 minutes per week of moderate intensity exercise. So what does that mean? The easiest way to break it down would be 30 minutes every day, 5 times a week. The best part about this is that the 30 minutes don't have to be it doesn't have to be all at one time. If you can't, if you can't squeeze in 30 minutes into your schedule, which a lot of people do have such intense schedules, even doing 3 10-minute or 2 15-minute bouts of just something. And I would say that you can either do the 30 minutes 5 times a week, or you can step it up a little bit. The American Heart Association also recommends 75 minutes of vigorous intensity, and that is 3 times a week. And a total of 3 times a week. So that would equate to about 25 minutes 3 times a week. And so that would be more like your spinning class or your intense Zumba class or something like that. So I would say really, and the main thing that I like to explain to people is that pick what you like to do. If you like to cycle, if you like to dance, if you like to swim, or if you just like to walk, or run, do what it is that you like to do, because that is what you're going to stick with. A lot of times people get started on these exercise programs and they get discouraged because they don't see results, or maybe they're trying to do something they don't really enjoy. A lot of people really just don't enjoy exercise, and that's okay. Just pick the thing that is going to motivate you and that you will actually be able to accomplish.
That is extremely powerful with absolutely anything. If you, like what Gabriella just said, if you do what you love, your motivation allows you to keep going. After a few months, you might say, man, I'm tired of doing the same old thing.
Right.
It probably means that you might need to change it up. Add a few things that you would love to do in between. Sometimes, let's say you're not a runner. I've heard stories of people that end up loving to run, but if that ends up not being your thing, you can mix it up with activities that you like to do, like the Zumba, and so on and so forth. If you love sports, you can, incorporate basketball, your football, your baseball, but it can be a lot of fun in the process. It doesn't have to be something that's difficult to do. Do you have any last words before we conclude?
I certainly was nervous going into that clinical. It was new territory for me. I did not know what to expect, but I went into it with just an open mind and just with that desire to soak in as much knowledge as possible, and to really be intentional about the learning that I was experiencing. I took notes. I would go home and I would research the things I didn't understand. And so I would say to any of those students out there, you guys are either going into your clinicals or you are in your clinicals, making sure to really take those opportunities to learn and to glean as much information as you possibly can. If you are interested in cardiology and just cardiac rehab in general, I'd say go for it. Do as much shadowing as you can. Reach out to the places that have these cardiovascular institutes and see what you can get into. And I promise you won't be disappointed.
Excellent. Thank you very much, Gabriella. If you have any questions, feel free to comment below. You can also get a hold of me, contact me on my Facebook business page, which is Joseph N. Gugi. Gugi is Ngugi. It's not all that complicated. Physical therapy. So Joseph N. Gugi, physical therapy. And you can also find me at my website, jointpurposefit.com. It's at the bottom of your screen currently. But you can find me there. Feel free to send me an email. Feel free to send me any messages. If any of them are for Gabriella, I will make sure that she gets them and is able to respond to them. Would you be all right with that?
Of course.
All right, good. Now, everyone, have a great day or evening, and remember to keep your heart healthy.